back, everybody. Pains, twinges, and tweaks. Most of us have dealt with the sore back and other health problems. Sometimes the cause is obvious, picking up something too heavy, but most often it's those little things we do every day that throw things out of alignment. Please welcome Dr. James Lee, a chiropractor with Texas Spinal Care, and one of his patients, Doug Losak. Welcome to the show. Let's start with what chiropractic medicine is, because it's a wide range.
What chiropractic is, we restore the normal function of the spine by various means, manipulations. The latest is decompression therapy and laser to help to restore that joint to be proper so that the nerve can flow.
There's a lot to be said for alignment, because a lot of us think if we have to address pain that we have to either medicate it or do surgery on it. And what were you dealing with that you just said, I need some help?
Sciatic nerve shooting down my leg. I could barely walk. Me and my wife would go walking in the evenings. I'd make it to the next house and have to turn around and come back.
Yeah, a lot of pain.
I was listening to the radio, and he gives 2 free visits, and I took one, and it made a difference right then, first time.
Did you think it would work?
No.
You were just desperate to try anything.
Right, anything. I did the upside down hanging, the back to lowered, and everything. Nothing worked.
Okay, so what was it that you did to him that helped address that pain?
When he came in, we diagnosed him with a herniated disc in his back.
Right, which a lot of people say, okay, herniated disc, you're taking pain medication or you were doing surgery.
That was the traditional way. Now we have more advanced treatment. We do decompression therapy and laser to help to reverse the disc hernia, and the laser will help to heal.
Okay, you have the laser machine right here.
We have a demo for you today.
Show us how that works and what is it doing.
Okay, you want a demo?
Yeah.
Okay.
Okay,
this is a laser machine that when the tissue strike, when the photon strike the tissue, it will break up the scar tissue. It will reduce the inflammation that causes the pain.
Right, and so when you have that scar tissue, what's tough is that it's difficult for blood to flow to get oxygen to something for it to heal.
Exactly, no circulation.
Yeah.
And very stiff. When you wake up in the morning, you feel that stiffness, that's come from the scar tissue.
Yeah, now
so
I gotta tell you, I'm not feeling anything. And I would think that, okay, what's really happening here? But I got to tell you, I actually had this done on a shoulder and a knee of mine that both were giving me problems. And to avoid surgery, I thought, why not give it a try? And I was shocked, because for 3 years, I would wake up with horrible pain in my shoulder and knee. And just like Doug over here, you were shocked that something this simple would work.
Gone, yeah, good.
Because I can barely feel like maybe a little bit of warmth here.
Right, very warm, very subtle.
Okay.
And the photon going there increases the circulation.
So for you, Doug, you said right away you felt a difference?
Instantly.
Okay.
Day.
And how many times would you have to do something like that?
It depends on the severity of the problem. It could be from anywhere from 5, 10 times or even 20, 30 times. The bigger the problem, the more time it takes to heal.
We oftentimes hear about the importance of alignment.
Very important.
And so what does alignment mean? And every day we assault our alignment.
I mean, when you look at a person from the front, the shoulders to be level, the hip to be level, the head to be level. If you're crooked like this, it's not level.
And if you're slouching over?
Yeah, slouching forward is not good. So every day we need to exercise to keep your muscular strong so you can be balanced.
Okay, so let's look at some of the things that we do every day that we think are normal because our body feels normal in doing it. One of it is, like, we have a couple of our audience members have their legs crossed, for example.
Right, they sit like this all day is not a very good thing to do. So the best way to sit is like this.
Okay, get those legs uncrossed, people.
Sit up straight like this.
Patience everywhere.
Yeah. Okay, the other thing is how big your wallet is. How many gentlemen have wallets?
Right.
Okay.
If you have a wallet, and you put it in your back pocket, you sit on it. You're crooked like this for, say, you're driving from here to San Antonio.
So when you sit on it, yes, it does force you to sit a little crooked.
It makes your pelvis crooked.
Yeah.
And that can cause a lot of trouble.
Do you suggest getting another wallet to even it out, or?
Oh no, your wallet.
Yeah, my wallet. Carry it in your pocket. And then, of course, ladies, we have these handbags that we have the world in for little kids. It's a backpack. That also, look at it. Those are big bags up there. Yeah.
So that create imbalance.
Right.
So the best way to do is lighten it. Don't put too many things. For the wallet, when you drive, to put it aside.
How important is it for us to be sleeping on the right mattress and the right pillow?
Very important because you sleep there 8 hours to 10 hours a day. If it's not good, they're going to toss your spine out of alignment. The best position to sleep with a firm mattress, a good rounded pillow, and on your right side.
Okay, on your right side, so a good
right side.
rounded pillow so that it has some support,
Good support.
for your neck.
Firm mattress, so it won't cause a slouching effect, and sleep on your right side.
Yeah.
All right.
Because left side is in your heart.
Okay, Doug, tell us about some of the other health issues you had that kind of just disappeared once you really figured out what chiropractic medicine could do for you.
Well, I would walk around the house and I'd look back, my grandkids would limping like me. I don't limp no more.
Yeah.
And their pain's gone. And it's just, you just feel better. I mean, you're just alive. Everybody should do it regardless of a pain or not. It should be maintenance.
Yeah. Okay, so with
Because your daily life compacts you.
Right.
So you need to get undone.
And with the alignment, is it just opening up the flow of oxygen to the rest of our body?
It reduces the disc hernia, so the nerve impulses from the brain can travel to the spine and go to the body. It allows the body to heal.
That's amazing to me, because how many of you think that you gotta get out a knife to make something work? Right? We typically think that. So really, this should be considered medicine, and things like surgery should be considered alternative medicine.
Right.
Exactly.
My
I agree
dad is
with you.
doing it, and he's 80.
Wow.
And he's straightening up.
Okay.
He don't fall, like when he gets out of the recliner, he usually would fall back.
Right.
He don't no more.
That's amazing.
That's amazing.
Okay, and there's some other things that you say we should do when we wake up in the morning, some stretches and things that we should do.
Very important, because the neck is a gateway to the brain. If you don't, you need to exercise your neck every day, so the good circulation to the brain. Here's some of the demos that you can do. Every morning you get up, you go this way as far as you can.
Okay.
And you go the other way as far as you can.
Mm-hmm. Feels good. It's almost a buzz.
Yeah.
And you go to the right, and you go to the left, about 10 times.
Yeah.
You go chin to the chest.
So it's a simple thing to do every morning to start off your day right.
Every morning.
Toe.
Dr. Lee, thank you very much. Doug, we're glad you're feeling better.
Oh, yeah.
Dr. Lee has a special Great Day offer for you. When you contact his office, mention Great Day Houston and get the first 2 laser and decompression treatments for free. That's what Doug did. He said 2 treatments for free.
You'll be hooked.
All right. The number is 800-NEW-4-LIFE, 800-NEW-4, the number 4, right? Life. For more information about Dr. Lee, log on to TexasSpinalCare.com, TexasSpinalCare.com. After the break,